Good day, fellow learners. Once again, this is your mentor, your Pache, Padre Gapuz, joining you for another teaching and learning session. This time around, we're going to talk about your next generation NCLEX and pointers number 3. So for this specific set of pointers, I'm so happy to share with you some of the things that I know some of you may not necessarily would dig deep into as you prepare for your NCLEX RN. But you may have heard it from your friends that you need to study this. But my goal for today is to highlight what are the things that you need to remember for these specific topics that I'm going to share with all of you guys. But before that, let's get some inspiration from a lady in Texas. Her name is Maria Teresa Hiles, who recently passed the NCLEX RN. And as a sign of gratitude, I'm so touched. She paid me a visit several days ago, and she came to my office. This picture with me was taken actually at the Ray Gapuz building at the second floor in our NCLEX RN simulation room. So I showed her our new tools, and she was just so grateful. And she gave me very, very inspiring insights as to how the program, specifically the system, helped her turn her great dream, which is to become a USRN by passing the NCLEX, into reality. So I'd like to ask everyone if you want to join our thousands of nurses from more than 30 countries in the world who pass the NCLEX into the Ray Gapuz system, give us a call. Look, these pictures are not reproduced anywhere. These are individual pictures. If you would notice, there's no repetition, okay? And be one among them, okay? They all pass through the Ray Gapuz system. So, the first thing that you might have in mind is, what will I study for the next generation NCLEX RN? So, the key is for you to get an expert opinion. But how do you get an expert opinion when you're just actually talking with friends who have taken the test, and which could be a good idea for getting a good glimpse or an overview of the test. But let me tell you, it's a very dangerous thing to do, to ask them questions, because the questions that they may be sharing with you are based on their own interpretations. And for the next generation NCLEX, that's not a good thing to do, because you will need to interpret the cases as you read them. So it always pays to have an expert guide you. Okay, so the first thing that I'd like to talk about that you may not have been able to browse your notes on would be the topic on vanishing twin syndrome, or this is called twin resorption. So vanishing twin syndrome is very simple. It's actually a form of miscarriage in which one of the twins eventually did not develop fully. So what could have caused this? It could be related to non-preventable DNA abnormalities or chromosomal abnormalities. So this is something that you cannot prevent. It's in the DNA, in the genes, or in the chromosomes. So what happens to the tissue? So the tissue gets reabsorbed by either the mother or the placenta or the other fetus. So if in case the healthier twin who survives and gets delivered after 9 months of pregnancy, is there any problem that they could potentially develop in the future? Well, literatures abound about the increased risk of the development of cerebral palsy into the other twin that is born from the original two babies in utero. So the question now is, will the death of one of the twins affect the other? Then the answer would be, if they share a placenta, then yes, the death of one of the twins will definitely affect the other. So when will a patient who is pregnant with twins expect to potentially have this problem? This usually occurs in the first 3 months of pregnancy, or the first 12 weeks, or the first trimester. But some cases usually also occurs on the second trimester. So it is not fully understood whether this could potentially run in families, but previously those who have had the experience for having vanishing twin syndrome have an increased chance, about 36% chance of having it again in the future. So The priority, therefore, for patients with vanishing twin syndrome is you need to closely monitor the pregnancy. The initial diagnostic test would be your ultrasound, which would initially show that the mother could be carrying twins, and then eventually one of the twins just vanished. And then this is verified through your cfDNA test, which means cell-free DNA test that's usually conducted in order to validate whether there was indeed a vanishing of the other twin. So how would you know that vanishing twin syndrome is occurring? You have to focus on the signs and symptoms. And remember the code PLUCK, P-L-U-C-K, P, pelvic pain, P, pelvic pain, L, that's going to be your light bleeding or spotting, U, ultrasound results would usually show resorption, meaning the disappearance of the other baby, C, chorionic gonadotropin decreases, and then K, known trauma or infection during pregnancy could have caused this. So, what could be potential questions to NCLEX RN topics that will cover this specific concept? So, a potential question could be, what is the priority discharge instruction for a patient with vanishing twin syndrome? And that's going to be ensuring adequate monitoring of pregnancy. Or some of the symptoms could be asked. So pay particular attention to the code that we talked about early on. Remember PLUCK, which means pelvic pain, L, light bleeding or spotting, U, ultrasound shows resorption, C, chorionic gonadotropin decreases, and finally K, known trauma or infection during pregnancy. So if the question would ask you, what will you find in the history of a patient with vanishing twin syndrome? It could be an incidence of vanishing twin syndrome in the past, or the presence of trauma during pregnancy, or the presence of infection during pregnancy. So those are the things I'd like to highlight with you related to this topic. And I just hope you're learning. Okay, so let's move on to the next topic that I'd like to share with you. For these specific pointers, you have Lioresal or Baclofen. This is a muscle relaxant. It has the same effect as that of methocarbamol or Robaxin. This is usually given to clients with spasticity. So clients with CVA would usually be given Baclofen. Clients with multiple sclerosis will also be given Baclofen. Even clients with Parkinson's disease will be given Baclofen. That is to lessen spasticity. Now, I'd like you to focus on the common side effects. Remember, DD and VC. So, DD and VC. So, D, dizziness, drowsiness. Then NV, that's going to be nausea, vomiting, and constipation. Once again, DD and VC. Dizziness, drowsiness, nausea, vomiting, and constipation. Now, what could be potential questions related to Lioresal or Baclofen that your test could potentially cover? It could be related to the effect. How will you know that it is effective? When there's lessening of muscle spasticity or relaxation of the muscles. How would you know that the patient is having side effects? So the patient could be having dizziness, drowsiness, nausea, vomiting, or constipation. Okay? There are also some literatures that identifies increased urination as a common side effect of Lioresal or Baclofen. So if you will be asked questions like, Lioresal is usually given to which of the following patients, then look for the patient with Parkinson's disease, or the patient with dysarthria or CVA, the patient with multiple sclerosis. Most of these patients with muscle stiffness can benefit from Lioresal or Baclofen. Okay? And of course, pay particular attention to your atrial fibrillation. Notice that in atrial fibrillation, the distance between one QRS to the other, these are all unequal. So it simply means you have irregular QRS, and then you have small P waves. These are called fibrillatory waves or F waves. So when these two are present, then you have atrial fibrillation. Now, atrial fibrillation commonly occurs in the elderly who would frequently experience orthostatic hypotension. So if an elderly patient is having frequent orthostatic hypotension, and okay, they have had history of transient ischemic attack or stroke in the past, then chances are they could be having atrial fibrillation. Why? Because most patients with atrial fibrillation are considered most at risk to stroke. Why? Because in atrial fibrillation, cardiac contraction could go as high as 250 to 400 to 600. So instead of the heart pumping adequately, it just quivers. When it does, okay, clots form usually in the atrial appendage, okay, and when clots form in that area, the clot could potentially travel to the small blood vessels in the brain, causing embolism. So cerebral embolism is a form of stroke. Ischemic stroke are of two types, cerebral embolism and thrombosis. Thrombosis occurs when the clot forms directly in the brain. Embolism occurs when the clot forms somewhere else and travels to the brain. In the case of a patient with atrial fibrillation, the clot could have formed in the heart and travel to the brain. So in which case, the patient will need to undergo magnetic resonance imaging. And the purpose of the MRI is that to identify whether the clot is related to a cardiac condition. So which means that the MRI is done because most clots that cause CVA are cardiac in origin and usually would be associated with atrial fibrillation. So therefore, we have two priorities for a patient with atrial fibrillation. One is to address the increase in cardiac contraction. So medications that would help decrease the heart rate, like digoxin or verapamil, would usually given to the patient. Now, pay particular attention to the fact that your verapamil, which is a calcium channel blocker, should not be given with grapefruit juice, as grapefruit juice would increase the serum level of the drug and may potentially lead to toxic reactions. Now, the second important thing is to prevent clot formation. So we administer your anticoagulants like heparin, aspirin, warfarin, but the most effective for atrial fibrillation would be your dabigatran or pradaxa. So the parameter that you have to remember in terms of the administration of digoxin or verapamil will be the pulse rate, and the parameter that you have to check in terms of the administration of your dabigatran, which is an anticoagulant, will be the partial thromboplastin time or the activated partial thromboplastin time of the patient. Don't worry about normal values in the test. The normal values will be contained and will be used as reference values. So that's one difficulty eliminated because you don't have to memorize your normal values once again. So what are the potential questions that you may want to focus on when you're studying atrial fibrillation? Take a look at this strip and ask yourself, if you are given this strip and then you will be asked what medication will you need to prepare, definitely that's your anticoagulant. You'll be asked what complication to develop, definitely it's going to be stroke or cerebral embolism, okay, or ischemic stroke. Then if you will be asked what medication will you need to prepare, then talk about digoxin or verapamil or your dabigatran or pradaxa. Now, what about if the reverse is asked? What medication do you need to clarify if inadvertently the doctor orders it? So that's going to be your atropine sulfate, because your atropine sulfate could further increase the heart rate of a patient. So therefore, it can potentially worsen your atrial fibrillation. Okay, so those are the things that I'd like to share with you in terms of your NCLEX RN alert and pointers. Okay, so this is actually the left atrial appendage where most clots would form in a patient with atrial fibrillation. And to prevent the clot formation in the atrial appendage, usually a procedure known as Watchmans Procedure. So they will have to insert, okay, a small mesh in that area to prevent clot formation. Okay, so that's your Watchmans Procedure. Okay, so to provide you with more inspiration, let's listen to what Tess Hiles would share to us. Here we go.
So which part of the class helped you the most? quick
It helps
fix
me
at
really.
saka
I learn a lot on
Very
functional
simple.
concept. Quick fix is the best. You have to learn and study
ito
every
gusto
single
ko
word.
nga kaso hindi.
So she says functional concepts and quick fix is best. Now, these are free sessions that I conduct every month. You can join, and all you have to do is to give us a call if you have problems related to what tips would you need to focus on. So we have here is Geraldine Montejo, who recently passed the next generation NCLEX, and Miss Tess Hiles, joining me in our NCLEX simulation room. Here's some more.
Hindi ko siya matatapos.
In America, there are a lot of programs. What sets the Ray Gapuz program different?
Because it helps you to coach you the right thing, the right way to answer questions, and you listen very careful in all the words.
And the rationale is very simple. Very simple
okay.
and very clear.
Even no matter what kind of questions they throw it to you, if you listen, you absorb everything, you will get the right answer. Select all apply. I get questions 1 all the way to question 7, 8. Select all that apply. Sarah is the best.
Yeah, even I tried the select all that apply here. Even if those I feel like I'm having difficulty.
Okay, so Tess is actually talking about the drills that we have. I usually give them select all that apply questions that are very lengthy. And initially, of course, they didn't want it. But now she's saying it has benefited her that much because it has helped her develop her mental stamina for those kinds of questions. Let's move on some more.
With the pharmacology, because some of the medications I did not even know that one is since I was in
Pharma,
when I tried this, my score is high.
You know, even in States, even though I'm sitting, studying, I turn on the TV, focus on the YouTube. I don't waste time to study the race Gapuz. All that I...
So Tess once again is telling us that she regularly watches my YouTube channel, and of course you can access that for free. So that's another thing that we have to emulate from her.
All that I... Siguro naka 3 reviewers ako sa US. But I set aside all of that. I focus on Surrey. I passed the NCLEX.
So Tess said she attended several review classes in US-based test preparation centers, but she set those aside and focus on what we've taken up in our class. I'm so honored that Tess chose our system. Thank you very much.
Congratulations, thank you, Tess. And you came all the way from the US
I cannot go
just
back
to come here in the office.
Say thank you, Surrey. I am really grateful. I am 53 years old. I thought it's just the end of the world.
Never too late. No.
I learned a lot of Surrey. If I could say something, everything to the student, just focus, listen, because every words, everything that Surrey throw it to the class, pick it up.
Yeah.
Pick it up, don't waste anything, retain on your brain. No matter what questions they throw it to you guys, you can answer it.
Thank you.
Yes, you can do that. Everybody
I
can do
claim
so.
it now.
You gotta claim, you gotta pray, and listen to what Sir Ray is telling to everybody because he knows. He knows. Kasi marami namang students talaga na, oh no. What? I passed the NCLEX, I bought the ABC. I bought the ABC because, it's if you consistent learning, you help a lot of people, and I do believe on that. I'm grateful. Grateful for RA Gapuz. Yes, if I could pick
And thank you for flying here to the Philippines just to see me.
I am very grateful.
Lisa,
Sir
I'm
Ray.
so happy, sir, that you came.
I'm grateful.
I'm very happy that I meet
Students, you have to listen to Sir.
Thank you.
Regardless to Sir, everything, the functional concept, the quick fix. Oh, as long as you get many quick fix and boot camp, you better do not waste that time. Jump.
Now, once again, the bootcamp is a 10-day program that I conduct quarterly. So you may want to join us. So give us a call if you want to find out the details. It's me exclusively conducting the bootcamp for 10 days.
To every bit of it. Jump every bit of it. Huwag mo sabihin you're tired. No. You have all the lot of time to take rest once you pass the NCLEX. Right, Sir Ray?
Yes, thank you.
So we're mag-picture tayo.
Yes.
Yeah, and if I could tell to everybody, don't waste time. Tired is okay. I work, I study. I work 9 to 5 in the US, sleep 1 hour, I turn on my computer at 8, I sleep at 3 o'clock in the morning, get up at 6 to go to work. I tell to my boss, if I'm done with my work and I start it around 1, 2 o'clock in the afternoon in the US, I open my book. My boss said it's okay.
Me, my work is 8 to 5, and then the difference is the time difference between Saudi and the Philippines. So I have to wake up at 4 a.m.
It's okay. Do not think about the time.
And then I do my replays in the
It's
videos.
tiring, but it's rewarding.
Yeah, it's
Yes. Final message, Madam.
Don't study hard. I love everybody. I am grateful and good luck. God will provide on the right time.
Okay, thank you.
Kasi kanina eh.
Oo, tapos
Imagine ako.
Now, here are the three of us now. We're trying to inspire Geraldine, who was then preparing for her test. And this is part of our conversation. Let's listen and let's get some lessons out of this.
Nagre-review na ako, namupo pa ako. Lahat ng pag nakikita ko nagdididig yung pugo, nakakonect na ako yan. I don't waste every single time. Do that.
Yes.
See? So it's an experience. It's a sign that you have somebody
Yes.
there who's telling you what to
The thing
do.
is, you got to think. You fly all the way to the
Yes.
to the ways, and if you could put your brain to the radio, sir, actually, sabi ko sa husband ko, sir, no? So, actually, 8 o'clock, 7 o'clock, pinag-exam na ako sa peers review. Sabi nga no, tapos sabi nung, pag about 3 hours, sabi ng husband ko, are you done? I said, no, this is how he asked me question. Are you done? Just like, parang bilis mo, parang gano'n, parang, I said, cut it off. Don't talk to me, cut it off. Kasi, sir, honestly, I feel like I failed. But the more difficult questions you give,
The higher level you went up the...
yes.
the-
Sir,
So that's one thing that we have to learn from her. The more difficult questions that you get, it means you're getting up the ladder of Bloom's taxonomy, and so that's a good indication that you're most likely to pass the test. Great insight.
actually, first question is easy, second is kind of difficult, third, fourth, all the way.
Yeah, that simply means you're answering it correctly because you're going up the ladder of the question.
That's why I love surveys, concept, functional concept is help a lot. Quick fix, a lot.
Okay, so she likes the functional concepts method, which is unique to the Gapuz system. Remember, it's just a word, a phrase, or a sentence that gives you a sense of direction as to how you'll answer the question. And she keeps on talking about quick fix and the boot camp.
A lot. And boot camp, you attend on that. And then through everything you do, focus on what he said, focus on this, focus on every book. I'm telling you, natutulog na ako, naka-quick fix pa yung nasa akin.
Ako rin gano'n. Natutulog na ako, naka-click pa yung
is also very helpful at organizing
Yeah.
things.
And then if kasi may rationalis na rin yun, tapos pag nadadaanan mo na, you have to, the thing about that is no matter how they throw you the question, sir, you know how to answer it. Do not waste. Pag sinabi na you go, ayan mo na yung pagod ka. Take a lot of food and huwag kang magpambakong-busog.
Kaya mas lalong na anto.
No, that, sir, ako, old school ako.
But when you saw that, I showed you kanina, so go look at the interface.
Yes, sabi ko, sir, question ko yan Yung mga reservoir.
So she was talking about some of the questions that she put into our course shell, and she said, well, some similar questions to what she actually encountered in the past. So that's a very, very critical point you may want to consider, okay, when you choose a learning management system to enable you to pass the NCLEX. Choose those that are very, very much aligned, almost similar to the actual experience.
Kikinig ako dyan. And then even I'm listening, I'm writing. I'm old school.
I was telling her, yung course shell, that's a new one, di ba? That's even like $149 lang for the entire
Oh, that's
thing.
cheap.
Yeah,
That
see?
is cheap. If you pass, for help you to pass, I'll take it. I don't look anymore the money, I just want to pass my case. And I thought every bit from viewer to all the other review center, I focus on the
Helen Viewer is also good kasi nung
Sir, kasi the thing about the
pero
viewer,
parang hindi na siya nag-innovate.
kasi the problem about viewer is just like you're reading the book. You're just wasting time. This, they throw you every question that you encountered in NCLEX. The innovations is perfect. how Sir answering the questions and how you facing the questions, exactly what's gonna come out of the questions.
Oh my God.
That's why every
So what she's saying is the concepts we were highlighting were really helpful because it gave her a sense of direction and it highlighted the things that she needs to remember for the test. Way to go. Great reflections.
the doctorate teaching everybody. I wish I could say, you all need to listen, listen, and focus.
Yes.
So that's a key important lesson. Listen and focus. Okay? So that's what she was saying. Okay, so let's have some more.
Hearing it from somebody
Yes.
who went through a lot. Yeah.
I went through a lot. I
see.
waste tons of money.
This is my first time review center. Yeah, I didn't choose any.
Don't. Focus on what you
Because
do.
she got into a lot of test preparation centers also.
I've been through a lot. But Sir is the best.
Thank you.
I keep telling to my mom, I said, so actually, about 6-7 years ago, I called here.
Really?
Yes, I thought you already
Maybe
have
it's
a
not
online.
yet
It's
the
not yet.
time. Oh, you see? God's perfect
And
timing.
then, it's just like I said, I need one more review. That's talagang I'm still thinking about.
So that's what she's saying. Focus on only one. If you trust the system you're in, focus. Don't try to mix a lot of things.
RA Gapuz. So happened I opened the YouTube. I saw Sir RA Gapuz in class. Sabi ko, I called my brother right away. Can you call RA Gapuz? I said, how can I do the online before one more review to take the test? Then one more review to take the test. Because I feel like not confident after all the review. Sa US? No, I'm not
I really
confident.
like your
Thank you, sir. Diba?
very
Sabi ko,
classic.
one more review. After everything that's happening, hindi na ako nag-open mo. Viewer ko na yan, sir. I don't open that. What I have is a functional concept, all these materials from Sir A.
So, Tess did our online classes exclusively.
All the books that I have. Biblia ko yung 311. Biblia ko yung pharmacology. Biblia ko yan eh. Yan ang Bible ko every day.
It was good.
Yes,
right?
it is, sir. Plus, you
And
know
we
what?
synthesize it dun sa
Yes.
mistakes. If I don't
Yes.
want you to be confused. So we just focus on this, and it helped you.
It helps a lot because it's the same questions. It's not necessarily copy questions, but no matter what
The
questions, the
concept.
concept is there. That's why no matter what they throw you questions, if you know the concept, boom. Can you imagine sila kung gatapay? Sa talas yun na! Sa talas! Parusa yun! Sa parusa yun
It was really a blessing that you have the opportunity. So I'll give you more time to, 3 minutes to talk to.
Okay, so the second and the most important thing, you have to have the right technology. When you study for the NCLEX, you have to undergo simulation, okay, that provides you with a near perfect example of the actual experience you will have while test taking, because that will decrease your anxiety. So our course shell that covers all the subject areas in the NCLEX, like safety and infection control, basic care and comfort, health promotion and maintenance, management of care, physiological adaptation, reduction of risk potential, and psychosocial integrity. This is the Ray Gapuz course shell. And you just have to give us a call if you want to avail this. And the third and the most important thing, you have to have a conducive environment. This is our simulation room, the Ray Gapuz Center, here in the Ray Gapuz building in UN Avenue, Manila. And of course, this is how we conduct our classes in a very comfortable environment. So may I invite you to avail of our next generation NCLEX RN Flex, the most flexible test prep class for the NCLEX RN. So you have a choice of live face-to-face class, or if you want live virtual class, or on-demand unlimited recorded video watching, you can do it. We have QBank. We have 3 books that we publish ourselves. Next Generation NCLEX Strategies, exclusively by me. And of course, my quick fix session, you can either have it online or virtually, or you can choose to come see me, join me live. So only the fee starts at only 3,499. So send us an email at info@ragapsreview.com or call us at 0906-201-9383. Once again, 0906 201-9383. See you at the Ray Gapuz Center here at Ray Gapuz Building in Manila. So once again, till our next video, this is your mentor, your fact check buddy Ray Gapuz saying, a functional concept a day helps eliminate your NCLEX RN fears away. So, this is Ray Gapuz saying, till our next video. Take care. God bless you. May you pass the NCLEX by listening to my video. Okay?